What's up, everybody? 10 News reporter Garen Flowers here. We'll let some folks come on. This is Dr. Edward Leonard, a chiropractor in Tampa. Thanks for joining me. I really appreciate it.
Thanks for having me, Garen.
Yeah, absolutely. So if you want to share this post on your phone, it should be up there now, and I will let some more folks come on, and then we'll start talking about this opioid addiction and crisis that's going on in our area and everywhere. All right, so this morning on Brightside, I aired my story about opioid addiction, but more importantly than addiction, let's get you in there a little bit more, and more importantly about addiction, alternative treatments that can help people wean people off of opioids or prevent people from going on them in the first place. So I interviewed you for my story. Thanks for doing that. So, you've been talking to me about these alternative treatments. What do you mean by that? What are alternative treatments to taking pills?
So anything that can help manage pain a little better. So whether it be chiropractic manipulation, acupuncture, massage, tai chi, anything that's non-combative and not a dangerous drug would be a better option than a lot of these opioids if that can manage it.
Yeah. So let's say I, break my arm or have a disease or something like that. How could these affect me more than a pill that could just kind of take the pain away?
So that's a good question. So for acute trauma, especially like a fractured or something along those lines, it might be a great intervention to start to kind of get through that breakthrough pain. But according to the American Academy of Neurology, there's no evidence that it's really helpful after a month of treatment, and they strongly advise discontinuing that. So you need to find alternatives or risk becoming addicted.
Absolutely. So basically, if you have a serious issue, taking pills for a month or so, can alleviate pain, but you should try to have a plan to get yourself off of it.
Precisely.
Yeah.
So the truth though is how do you help someone who's already addicted? That's the most challenging thing, and I don't have an easy answer. We have a lot of rehab clinics and Suboxone and other therapies that can try and reduce people's addiction to opioids. However, that's a much harder journey than prevention, an ounce of prevention is worth a pound of cure in all things. There's no shortcuts in life, as we know.
Yeah, absolutely. So when I interviewed you, I spoke to one of your patients, a guy named Mauricio, who was hit by a car, terrible injury. He said that acupuncture and massage therapy and chiropractic care helps out a lot. Why do you think it helps him out?
So I did my training in acupuncture at Harvard Medical School, and we had two course directors.
It helps him out.
One was a acupuncturist from Japan, documented practicing in our family for like 800 years, and the other one was the chief of pain and physical medicine for Harvard Medical School's hospital system. And he would talk a lot about functional MRI results and how certain acupuncture points can trigger release of endorphins or neurotransmitters to make you feel better, and might have a pain block mechanism. Same with manipulation. If you have a stiff joint, it can fire pain fighters to really drive pain. So allowing normal range of motion in that joint during routine activities like walking would help someone on a long-term basis, far above and beyond that one moment that they got adjusted.
Absolutely. So we also talked about in the story about being able to, the importance of weaning yourself off of these is so you don't get addicted. So most people get addicted to drugs, prescription drugs, because of pain.
Correct. Yeah, so the last year, 42,000 people in the United States died from opioid overdosing, just from drugs. 19,000 or 17,000 of those were physician prescribed. Of the others that were not physician prescribed, they may have been at one point physician prescribed, and they turned to alternatives that are cheaper and easier to obtain now sometimes, and that would be heroin and other ways of getting them on the street, which are far more dangerous. So it's just this is a doctor problem. We need to make our approach patient-centered, not special interest centered, and I'm afraid that's what the current scenario is, and that's what's driving a lot of this.
When you say special interests, you're saying doctors are prescribing these drugs because the relationship they have with pharmaceutical companies?
That might be part of it. So there's turf wars. So some physician groups want to be able to protect their rights and prevent other people from having access to patients. So there's a big issue with getting access to alternatives like chiropractic and acupuncture. There's no chiropractic department in the hospitals. There's no acupuncture department in the hospitals. To if you even have the benefit plans that allow you to see these physicians, it's a specialist copay and higher deductibles and higher co-insurances. So the barrier for treatment and access to treatment is so high. It's so much easier to do a primary care copay for $10 and get a drug that has very little expense to the patient than to go through all of these steps. So that's we need more access. We need access at every line of every, make it about the patient, not about whether it be a physical therapist, a chiropractor, an acupuncturist, make it about the patient. Exactly.
Let's get to some of these comments here really quick. So Sky Houston has an interesting comment here. She says, I have degenerative joints in my neck, osteophytes from my C2 to my C7, et cetera, none of these alternative methods will help my issue. I hate opioids. They make me feel like crap. MMJ, on the other hand, helps. It is not a miracle, but it helps with the pain. It helps sleep until I can get into surgery. MMJ, have you heard of that? Or it might be a drug or whatever, if you can specify that, Sky. But it sounds like a lot of people feel pain and don't think that those methods will lead to, people aren't sold that those methods will lead to being alleviated pain like a pill would.
So thank you for sharing your story with us, Sky. I
Absolutely.
appreciate that.
Yeah.
And you know, I see degenerative disc osteophytosis on every day of my professional career when I treat patients. So it's something I'm very familiar with. And the truth is, I always hear patients have gone through various journeys and struggles with their care, and I can tell you there's not a perfect silver bullet to any of this. It's an all of the above approach, and you should take a conservative effort first and slowly, gradually work your way from things that are safe, like massage, acupuncture, chiropractic, and physical therapy. And if that failed you for whatever reason, maybe it progressed to injections or nerve blocks or other interventional procedures, anything that won't make you addicted on dangerous drugs that are killing America enough to the point where we're lowering our life expectancy as a nation. We're the only first world nation that is lowering our life expectancy, and the CDC attributes it to overdosing of opioids, and a lot of them are physician prescribed.
All right, so Teresa Stump says, I'm a firm believer in methadone and Suboxone for people who have permanent pain. And if you go to a clinic and work a program, you can have a decent life. So are those drugs or whatever?
So yeah, those are drugs they're narcotic. They're on the lighter end of the spectrum of narcotics, and they are used a lot to try and break addiction of the harder narcotics. They still are narcotics, but you can certainly have a more functional lifestyle with them. But they are not necessarily nuts. They're not safe. They're Schedule II.
Yeah.
They're regulated equally as heroin. So not heroin. Sorry. Propofol. Not
Propofol or whatever.
yeah, not even propofol, but it's morphine.
Morphine, okay, morphine, absolutely. So Becky Broadcorb says, I get acupuncture and I have been doing so for years now. It's amazing, but it's not a one-time treatment. Half of my spine is titanium from multiple surgeries, and acupuncture is the only treatment that actually relieves my pain. Opioids just mask the pain, and you have to be willing to give up the pills as well.
That's true. So mentality on this is the most critical aspect if you are in was that Melanie?
Yes, Becky.
Becky's shoes. So yeah, if you don't have the mental outlook to try and modify behavior of one of the most addicting things on the planet, then you're going to have an uphill struggle. And I'm really glad to hear you have relief with acupuncture as an opportunity. And a lot of my patients have a mix of, they see me once a week for acupuncture to manage their pain for chronic issues, but they also, when they do have that breakthrough pain, require that on occasion to supplement that with a narcotic to help their quality of life, and it's all about mentality on that for sure.
And there's some great comments here. I'm going to get to those in a second, folks, but really quick, the purpose of my story was not to talk about the alternative treatments and natural treatments or things that are better options than opioids. The purpose of the story was to talk about how those things aren't being covered by insurance companies. So actually that PowerPoint right there is what I said earlier, things you can do. What would you recommend for someone who can't afford it or their insurance company doesn't pay for acupuncture? What do you recommend?
So that's a good question, because this is an access. I really love your point on that, to try and negotiate with the doctor, because most doctors are in it for the best of reasons, and that's patient outcomes. And a lot of times we'll try and work with people to make sure that they can get the help they need, and that would be option one. I think that would be the best option. Yeah. So if you can't afford it, or you have difficulty accessing it, find that, or there are alternatives. So the Florida Wellness Medical Group, we have a $49 acupuncture session, which is half the rate if you join a membership. And same with chiropractic, the chiropractic place, they have about a $19 adjustment. And Massage Envy, they have $59 1-hour massages. There are a lot of competitive products on the market today, and they are lowering the barrier for entry, and those bring a lot more massage, acupuncture, and chiropractic patients to those services that never would have, because they always have the stigma of cost. One of the biggest stigmas of accessing alternative treatments is what does this cost?
Absolutely.
Chiropractic runs that really middle of the line. Is it alternative? Is it mainstream? Half of Americans have seen a chiropractor, and a lot more insurances cover it for that reason. So in Florida, it's rare to not have some sort of benefit, but we'll go back to that issue: is higher copay, higher deductible, specialist copay. That a conversation with the staff or the physician may really go a long way for you accessing the care that you might want to try out or need.
Yeah, so really checking with the doctor and with the insurance company, you might be able to get these things covered, or have a copay for it.
Exactly.
Okay. I'm going to run through some quick ones here. Karen Hilbron, hopefully I said that right. There's no need to suffer when there's alternatives out there to treat chronic pain and addictions. Thank you for that. This one's really interesting, from Mary Watson. When your vertebrae are collapsing and nerves are being pinched 24/7, the pain medication relieves the pain. Also, there are extended relief pain medication. The people who take the pain medication need them.
So yeah, I mean, Mary, that's a good point, and I appreciate you chiming in on that. I as a practitioner, I have seen the most gnarly X-rays and MRIs of the most debilitating, looking at that person and looking at their films and saying, how are you even walking right now? And they're fine. They're like, oh, I don't even feel much. And I've seen very normal MRIs and X-rays that people are pulling their hair out in pain. That physiology isn't necessarily the structure. So for particular things, obviously if you have pathology on MRI, the incidence of pain is higher. But according to I'll just quote the American Academy of Neurology again, there's really no benefit beyond a month of continual narcotic treatment. They feel like, the Academy feels like that they are there's too much risk for dependency, and it's going to be detrimental to that patient more than beneficial.
Absolutely, absolutely. A lot of people mentioning Suboxone as a popular thing. Kratom, people are mentioning Kratom, which we've actually done stories on before. A method that's a little controversial, but is growing in popularity. Medical marijuana is out there. That's a natural method that people are talking about. Let's see here. Amanda Garcia says, I believe facing the things that lead to addictions should be primary focus. So what would you say is the things that lead to addiction?
That's a great point. Gateways are always a concern, and that was Nancy Reagan's push in the 80s for the war on drugs. We had a big push against marijuana that I could argue probably fueled more drug use or making it
worse or whatever.
Yeah, making it worse. So I don't know. I feel like physicians still, especially an MD, they're the cultural authority in healthcare today. They have been for the last 100 years. And if they say you need this narcotic, that goes so into someone's conscious, subconscious behavior that they identify as, this is okay, this is right, this is normal. And so I'm personally okay with medical marijuana and even the legalization of it without medical purposes. I think it's not worse than alcohol on various levels and other things. So I am not of that gateway philosophy that it's bad for society. But I can understand the argument, though, and it's a good point to bring up.
So Lisa Gardner Oxendine is a little skeptical. She says, So people suffer, insurance costs us a fortune, and we are not made of money to spend $65 a visit twice a week for chiropractic help that doesn't work, or a hello that doesn't work. You know, I go to a chiropractor, it's $20 for a session, so that's a lot cheaper than the $65. People probably have this idea in their head that it costs more, and some chiropractors might charge that, but you know, like I said, I personally go to a chiropractor, it costs me $20 a session, but a lot of people probably feel this way.
Yeah, that's so the Gallup poll, the one that does all the national polling, they polled chiropractic services for this particular issue, and they found that the vast majority of people who have never been to one fear the price. But the joint the chiropractic place, they're a $18 or $19 adjustment if you're part of their membership plan. Or there are alternatives, and even if some chiropractors, they might charge that $65 option. If you tell them you can't afford that, most I know personally would probably work with you to try and make sure that they help you. And if they don't, then they might not be the best chiropractor to go see, because they might have alternative interest in patient care. But I'm not saying that about your chiropractor. I'm saying that if someone needs help, they can find it, and it doesn't have to be $65 a visit twice a week. I understand that would be a burden for most people.
That could be huge. That could be a really bad burden. Robin Nesbitt says you can get addicted to Suboxone as well. Suboxone or Suboxone, however you say it, is supposed to help with sickness. You're supposed to work the program. You don't have to be on Suboxone for 5 years. Lethea Carter says methadone is awful to get. Patricia Line says, yeah, let's get them addicted to another narcotic. That's the right thing to do, being sarcastic there. A lot of people talking about Suboxone. That's a popular one, I guess, that you said that's a lower level.
It's still narcotic.
Narcotic.
Yeah. But it's one we treat to try and disable addiction.
Mm-hmm. Try other treatments it didn't work. You can abuse anything, says Tessa. Mary Watson again says, personally, I've tried everything and nothing worked. So what do you say to people who feel like they kind of just losing hope on anything?
So that's hope is the most critical component of healing. And Mary, I can feel your struggle on that, and I'm really sorry to hear you go through a journey where hope is elusive and not within reach. I would, do my best to exhaust the end of the earth, whether it be Reiki or meditation or just try and psychiatric counseling, psychological counseling, to try and find a way to believe that there's an opportunity to bring healing, because it really that's the most critical part of any healing process. And,
yeah. Tabitha Stewart says, if you are an addict or you use opioid incorrectly, get some other help before it's too late. Natural medication is out there. Even putting together herbs for teas will help. Do the research. You don't necessarily need health insurance. What do you think about that? Just kind of people just...
So ounce of prevention is worth a pound of cure. So we all focus on our visible hygiene, so like brushing your teeth and flossing your teeth. What do you do for your spine every day?
Yeah.
Nothing. So things like yoga and stretching are really wonderful at-home, no-cost options one can elect to do to preserve their spine, because just like your teeth, your spine decays if it's exposed to if it's a disc herniation, that's like a root canal, and there are no spinal transplants, there are no dentures for spines, and it's the core of your whole system, and spine pain obviously drives this opioid crisis. So I would strongly advise people self-managing and self-maintaining and preventing a lot of these issues, and if they haven't, then to manage them with it is a good point.
Absolutely. Let's see here. Brandy Ortiz says, I have pain all day, every day, but I refuse to take pain pills. I deal with it. A lot of people have said that they just deal with it. They might not know about the alternatives, but they just don't want to take pain pills. They just don't want to deal with that. Do you meet people like that who just fight through the pain?
I think that's most humans. Yeah, not everyone, but a lot of people. If you start to mask any problem in your life, whether it be emotional with alcohol or pain with narcotics, you don't know how to attenuate them, so you don't know how to face those issues very well in life. So I think every human being has an onslaught of life coming at them, pain and otherwise.
Exactly.
And if you're not managing them naturally or holistically, you become dependent on certain things.
Absolutely. Deb Rue says, my insurance does not cover the alternative. It pushes us into the drugs.
That I agree with her entirely. That's the problem. Yeah. It's a bit political on that.
Yeah, absolutely. Let's see here. Carla Holiday says, I get pain meds, but there's times when those don't help. I've had an injection in my back and came out of the office in more than when I went in. More pain than when I went in. So what do? I suck it up and do what I have to do to get through the day. I have a 3, almost 4-year-old that relies on me to take care of her. A lot of people are dealing with, like, family and stuff, and have families and don't want to deal with pills. I think people are realizing that pills might be good for you initially, like you said, might be good for you after surgery to alleviate some of the immediate pain, but it's not good for a lifespan of, they might keep you alive, they might alleviate pain, but what is it really doing for you in the long run? So I think people have to look at that, and everyone's case is different. I don't want to say that no one should be taking pills and that no one should be doing this and that. We can't tell you what to do with your life and anything like that, but I think what we're trying to do is talk about natural methods or alternative methods to alleviate having to take pills if possible. So that's the big thing. Kathleen United says, I'd rather suffer with the pain, and I do, than take something that would do more harm than good. Yes, that's really important. So, I hope all of you who are dealing with pain get to alleviate that pain. It hurts me to hear that people are in pain and dealing with that, and some people don't have the alternative treatments and don't have pills either, and they're just in pain. So
for our poorest segment of our population, their health insurance is Medicaid. Mm-hmm. It's for disabled as well as very low income patients, and they do cover chiropractic. So that might be an opportunity for even them. I think the copay for chiropractic on Medicaid is $1. Mm-hmm. So it should be. That's one option that the state has done, which we're grateful for.
Yeah. Let's see here. Once again, some people talking about alternatives like medical marijuana. Tessa Lambert says, you can abuse anything. If you're an addict in the state of mind, it doesn't matter what it is. You can abuse anything. So I'm sure there's even some natural things that people might take that they just have to be careful with. So sure. Everything in moderation, and go to a doctor and hear what a doctor has to say. Let's see here. Cheryl Hickson says, most addicts don't have money for alternative treatments. ! Most counties have help for addiction, such as methadone, which she doesn't recommend, or Suboxone, and it does work. And I heard it does relieve some pain. So once again, some people think that alternative treatments are a little too expensive. In the long run, how much are pills costing people as opposed to how much alternative treatments are costing people? Is it more for alternative treatments?
Yes, it is, even with insurance. So that's a big problem of it, and it really comes down to everyone's personal circumstances. So I personally have had patients walk in, blinged out, iPhone 10, rolling up in a very expensive car, but argue over a $10 copay, because that's the culture of their, or the nature of their culture, their thinking.
Yeah, absolutely.
So that it really is a lot of things in life are personal priorities, and unfortunately we have a dichotomy. We have a culture of we expect healthcare, but our healthcare options are very patient expense driven, especially in the alternative realm. So it's there's a dichotomy between those two things, and it's always trying to
absolutely
find a common ground on those.
Danny Clark, great to see this. Clean and sober here for 29 years, and that's good to hear for him. Cheryl Hickson says, bottom line, there's not enough help for addicts. Addiction treatment and help is a joke in this country. Would you say that there's not enough help out there for people who are dealing with this issue?
Help is a challenge. So even look at there's a. I think I read recently that it takes the average narcotic addict 9 times to rehab to cure an addiction. So I can't emphasize how important it is to prevent this more than to try and treat it, because if every addict needed 9 months in rehab at different points of their lives, and some more than that, and some don't make it that far, then maybe that might be an issue. You know?
Absolutely. Absolutely. So Carla Holiday says, my pain management doctor wants me to get more injections in my back because they work for him. However, with my body chemistry, it doesn't work for me. We were talking about politics with this story. Mm-hmm. Do you think that's part of the politics? The pain management or pharmaceuticals are kind of in bed with doctors, and so that's why they're prescribing whatever it is they may be?
So of course, every physician is different, but I have seen a lot of pain management doctors that are trying to get their patients off of drugs and offer interventional services like injections. Some are getting trouble from the DEA, who are trying to protect the consumer a little bit and saying you need alternatives, so they push these injections in to justify their medication regimen of the opioid or dangerous drugs, and so they don't feel comfortable treating you because they're getting audited or they're on a radar of sorts. Mm-hmm. So, but the truth is, if these alternatives that particular physician offered you are not working for you, ask for. There are a lot of alternatives. There are nerve blocks. There's radioablation, a frequency nerve ablation. There's so many alternatives that he might have limited tools in his war chest to adequately go after that particular case.
Absolutely. So let's see here. Lisa Gardner once again says, already tried chiropractic and insurance is still high. Didn't work, was in worse pain. So if someone does come to you and says it's not working for me, what would you do? What would you say?
Certainly try alternatives. Obviously, if there's no silver bullet to any of this, as I mentioned earlier. Try everything and take a conservative first approach to it.
All right, let's see here. Terrence Lee says America wants to keep you in pain. Love Big Pharma. Danny Clark, see it all the time. The time anyone can go to the hospital and complain they have pain, they just get a script and keep getting high. Seems like it's pretty easy to get pills from a doctor.
So there's one bottle of pills prescribed for every man and woman in America per year of narcotic opioids. So to say it's easy is an understatement. Obviously, the 330 million of us don't require a bottle of pills a year.
Yeah.
So yes, it's easy to get pills.
That's unbelievable. That's crazy. And once again, we're not trying to tell people how to live or that pills aren't useful and that they aren't helpful, because it does help a lot of people. Mauricio and even the other woman I interviewed in my story said that they were helpful, but they both don't want to be on pills. They don't want to be dependent on it for the rest of their life. So
I was telling Gavin, full disclosure, I own a pharmacy, and that case Mauricio, who allowed me to share his information with him, he has a zero copay for his opioid drugs. He has a $45 responsibility with his insurance for his chiropractic and acupuncture session, which he does once a week. So you can see that in his case, who has a Cadillac plan, which includes acupuncture benefits, he has a much larger barrier to obtain alternatives than it does to the zero copay for his opioid drugs, which is the nature of this discussion, and we need to make this patient-centered.
Absolutely. So we'll wrap it up here soon, but what would you recommend to people as far as preventing getting on opioids? What are some good life, natural, alternative treatments or things you can do that will help alleviate future pain or future incidents?
So it's the good old it's really easy. The 3 T's: trauma, thoughts, and toxins. So trauma, whether it be car accidents or falling out of trees, or repetitive stress from poor posture, sitting at a computer desk all day, a pitcher throwing the baseball 100 times a game, those are the traumas that I see most routinely are the repetitive strain. So be cognizant of where you are in space and time is the first thing. Toxins are not necessarily if you're next to Fukushima power plant, but what you put in your body every day, what you're exposing yourself routinely. Eating an anti-inflammatory diet, something like the Mediterranean diet, and staying away from the fad diets like keto diets and things like that.
Oh, you think those can prevent can allow toxins and stuff?
Mediterranean diets are rich in omega-3 fatty acids, lots of fish, anti-inflammatory, certainly. Yeah, so if you're eating an inflammatory diet, those inflammatory markers as well as those free radicals float around your bloodstream looking for cells to attack. And if it's your heart, you're prevalent to heart disease. If it's your spine, you're prevalent to back pain. So the toxins be very mindful of what you put in your mouth and how you do things, and every single day. This repeat stuff that really gets you in the end.
Absolutely.
And then thoughts. Be mindful of your mind. Everyone's faced with financial burdens, fighting with their other halves. Work stress. Stress really hits everyone.
Absolutely.
And knowing how to effectively manage the daily routine of the bombardment of data we receive, and a lot of it's negative, is really important to how you respond. So trauma, thoughts, and toxins, be mindful of those things.
Yeah.
If you did that, your dependency on any medical procedure, intervention, or otherwise alternative, natural.
And I want to go back to toxins. I've been reading stuff about how the detergent you use for your clothes could be toxic. The chemicals around your home could be toxic. At work there could be paint. There could be paint on the wall that could be could be toxic. Breathing that in. So there's so many things out there that we don't know. That's why I'm glad you said toxins. That stuff really has an impact on us, and can lead to cancer and all that stuff. So.
Free radicals can cause cancer.
Absolutely. So, thanks again for joining me, Dr. Eddie Leonard in Tampa,
Thanks,
chiropractor.
Facebook world.
Yeah, thank you guys. Thank you for talking to me for my story on opioids and alternative treatments. I'll keep the conversation going by commenting some of these people. If you want to hop in there and answer some of the comments, you're welcome as well. And make sure you guys check out my story, Alternatives to Opioids. It aired this morning, but we pinned a link to it at the top of this Facebook chat. So go to the top of this Facebook chat, and you will find my full story with Dr. Edward Leonard in it. And thank you guys for joining us. Really appreciate it. Cheryl, thank you. And thank you everyone who had something to say. I appreciate it.
Thank you.
Thanks, guys.